Tennis elbow and golfer elbow. It's very important. Let's start by tennis elbow. It's an inflammation at the point of attachment of the extensor muscles of the wrist, not arm, not forearm, okay? At the site of outer part of the elbow. So, for the keyword, pain at outer bony projection of the elbow. If you look at this picture, this represents the attachment of extensor muscles of the wrist. And pain in this area mean tennis elbow. For the cause, it's occurred due to repeated bending and twisting movements of the wrist, especially in case of tennis players, carpenters, or violinists. For the treatment, the first line of treatment is non-steroidal anti-inflammatory drugs, as it's an inflammatory process. And the second line of treatment is a brace below elbow. Focus on this. A brace below elbow, not at the elbow. And if you look at this picture, this represents brace below elbow, okay? And it's very important. And this is the second line of treatment in case of tennis elbow. Now let's talk about golfer's elbow. It's also called medial epicondylitis, and the tennis elbow called lateral epicondylitis. It's totally the same as tennis elbow, except it's involve flexor muscles of the wrist, not extensor muscles. So please focus on this, okay? And if you look at this picture, this represents the attachment point of the flexor muscles of the wrist. So pain in this area, it's mean golfer's elbow, okay? And it's also called medial epicondylitis. And for treatment, it's totally the same as tennis elbow. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.